Made this video kind of get everybody on the same page. We hope you enjoy it. If you have any questions, please leave comments at the bottom. We'd love to hear from you. Hey, welcome YouTube, patients, friends, and longtime colleagues. We want to kind of shoot this video today, just kind of go through some common questions that we hear. One of the biggest things we deal with is what to do after treatment in our office, especially after the first visit. So we can kind of go over that with you guys. If you've been with us, you understand that you've been examined, you've been possibly treated on the same day, and we've given you some things to think about before we see you the next time. Like I always tell patients, sometimes the treatment may vary. It might be something very simple, or it might be a set of exercises that we go through on the first visit. What we usually deal with is trying getting our imaging up to date. Sometimes we need x-ray when there's been trauma, such as in a car wreck. Sometimes we're dealing with chronic conditions where maybe a patient has, 2 or 3 MRIs over the last 2 or 3 years, and we need to kind of get them, analyze them, and create the right treatment plan for that solution. These are things that people don't think about. Normally we like to see an MRI that's maybe a year or less old before we can make a conclusion on certain type of conditions. One of the biggest questions I get, is after you're injured is what do we do? What I always tell patients is injuries are basically a combination of inflammation, trauma to the body, whether it's the elbow, whether it's the back, whether it's the neck. And inflammation to me does better with ice. Ice tends to kind of settle down the inflammation, because think of the inflammation like a fever. It's something that is going to spike because the body wants to localize it and kind of contain it so that way it can start working on those kind of on repair. Unfortunately, even with a chronic condition, the body will try to do that, but will be limited in its effect. So I tell everybody, ice first. We usually try to ice maybe twice a day, 10 to 15 minutes. Research shows anything over 15 minutes and you possibly could be wasting your time. I tell people sometimes it's psychological, it just feels good. Heat is usually in the 15 to 20 minute range. However, after initial injury, we usually recommend ice. Smaller joints, we're usually using ice for maybe 5 to 10 minutes. If you're dealing with maybe a wrist, an elbow, and so forth. Another thing that I tell patients is that when you come to me, a lot of times you've been injured for say a week, maybe months. It's easier to deal with these kind of pains by minimizing sitting. To me, sitting is the new smoking, aka we don't know what it does till 10 or 20 years later. That's why you're seeing this huge blow up in diagnoses lately, with disc degeneration, osteoarthritis, wear and tear, all these terms that we don't think about when we're younger in our 20s and 30s, but we start to feel the effects of them in their 40s and 50s. So please just remember that the back is unfortunately more achy when you sit on it, so it's better to stand or it's better to lay down. What I tell everybody is yes, support your knees, find the right place to lay down. If your bed's horrible, maybe find a guest bed or something that maybe gives you a little bit more relief. For some of you guys we're seeing for muscle strains, Epsom salt baths are a great thing, as long as you can get in and out of the tub, because sitting in that seat, sitting in the seated position in the heat is actually a pretty good thing sometimes when you've overdone it in the sport, when you've overdone it maybe working in the yard. The heat tends to, 1, expand the muscles, 2, it allows a lot of the toxins that come in and out, it allows the repair to happen that your body has to go through from a physiological standpoint. So it's a good thing. Last, most people don't think about is increasing your water. Water is a great carrier of byproducts, meaning when we have to flush certain joints because they're injured, water does a lot of that carrying. 2 is increasing your protein take. I think protein in our body has to build that muscle back. It has to help build the ligaments, the collagen. It has to build the tendons back on. So that's important things to take care of your diet, not just be eating whatever you can. Okay, so Just some tips for you to remember. Thank you for listening. And if you haven't already, please subscribe to our channel as we have great information coming to you.